Good afternoon. My name is John Capretta. I am the Vice President of the Columbus Firefighters Union, Local 67. I'm honored here with an opportunity to be at this press conference today. In Columbus, our paramedics are taking approximately 10 runs per 24-hour shift on opiate overdoses per day. This is nearly 4,000 runs every year, with man hours numbering in the 20,000 range, allocated to the citizens who are the face of the opiate epidemic in Ohio. I would ask you to please keep these stats in mind as you listen to the featured speakers today. With that said, it is my sincere privilege to be able to introduce our Columbus City Attorney Zach Klein. Thank you.
Appreciate it, John. Thank you, John, and thank you, Chief and Captain. Where did you go? They are for having us here. I'm Zach Klein. I'm the Columbus City Attorney. We're here today to announce a lawsuit against the Trump administration, President Donald Trump, Health and Human Services Department, as well as the Centers for Medicaid and Medicare Services. The crux of the lawsuit is simply this. Every step of the way, the Trump administration and the president himself has tried to sabotage the Affordable Care Act, which is undermining the confidence in our health markets, driving up the numbers of uninsured, and making premiums more expensive for families who are trying to find good quality health care for their families. This hurts the city of Columbus. It hurts it in two ways, really, and we're going to hear one of the ways from Dr. Roberts, our health commissioner, but it actually hurts them while we're here at a fire station. It hurts the city because the city's budget is directly affected by President Trump's actions. Here in the city of Columbus, we do roughly 132,000 medic runs a year. We recoup 40 to 80% of the cost of those runs from insurance coverage that the patients who are being transported have. So for example, if you're on a run and you get transported to the hospital, we then bill your insurance and try to recoup that money. That money then comes back to the city coffers. It helps fund the Division of Fire. If you do not have insurance, then there is really no way to recover money from, and we only recover about 4% of that money. We will send you a letter and say, here, we took you to the hospital. Can you please send us remit payment for that transport? But we only recover about 4% of those, and it is a policy decision of the City of Columbus not to seek collections to make sure we cover those costs, because we believe that for those who are struggling at the margins, who are uninsured or underinsured, that the City of Columbus should not be billing those individuals for the runs. Again, we're going to hear about how it directly relates to the Department of Public Health too, but just one, I think, notable example is the fact that our federally qualified health center, Primary One, the city funds at an average about $4.3 million a year. And just last year, we saw an increase of 3,000 more uninsured individuals that are coming through the doors. That's money that's not reimbursed. That's money that is eaten by Primary One, which means that that's more money that's being spent. That lessens the ability to provide more care that is necessary for underinsured and uninsured individuals. So we're suing basically on two claims. The first is a violation of the Administrative Procedures Act, which basically is a law that describes how rules makes rules. I know it kind of sounds complicated, but the reality is when a duly enacted law by Congress is put in place, the president has to follow in certain rules as it relates to implementing that law. You can't be in direct contradiction to those rules. A lot of the administrative rules from the Department of Health and Human Services and the Centers for Medicaid and Medicare Services, they directly contradict the language of what the ACA requires. The second is a violation of the Constitution, and that's the Take Care Clause under Article 2 of the United States Constitution, which requires that the President of the United States take care that the laws be faithfully executed. Here are some examples of the intentional, predetermined, and sabotage ways that the president is directly undermining the Affordable Care Act. Cutting navigator funding, redirecting advertising money that is designed to promote open enrollment, redirecting that money that is designed to promote open enrollment to now fund TV commercials to tell people how bad Obamacare is, and then cutting the open enrollment period in half. Now, those are just a few of the actions. Match that with the president's words. The administration has been so brazen about its intent to sabotage the ACA that the president himself has said that since Congress can't get its act together on health care, the administration's goal is to dismantle the ACA by executive action alone until Obamacare is finished, prompting the Democrats to come to the White House to negotiate its repeal. In April of 2017, the Trump administration announced open enrollment for 2018 would be cut in half from the prior period, and right thereafter, the president immediately tweeted, "Obamacare is in serious trouble." Well, no kidding. By his actions, he's creating the circumstances that's undermining Obamacare. And just yesterday, on the Rush Limbaugh show, President Trump said, "I've just about ended Obamacare." You couple those actions with his words, and you clearly see the premeditated effort that President Trump is using, the intentionality, the deliberateness to undermine insurance for families, driving up the number of uninsured, making it more expensive for families to provide health care. That has a direct effect on our city budget. It has a direct effect negatively on the people in the city of Columbus who appreciate the use of Medicaid expansion, who don't want to be discriminated against for pre-existing conditions, who have children that are staying on their parents' health insurance, who are participating in markets and using tax credits to make health care more affordable, as well as actually having plans that cover you when you're sick. All of that is at stake because of the president's deliberate and intentional undermining of the Affordable Care Act. I'm not new to this space. For the past 2 years, as council president, Mayor Andrew Ginther and I have traveled this community talking about, on the political side, the importance and the need to call your representative and call your senator in the fight against repeal and replace. We won that political battle. But now, as the Columbus City Attorney, there is a legal reason why the city of Columbus is involved in this lawsuit. It's because the president is violating federal law, he's violating his constitutional duties, and the time for criticism is now over. He does not have the unilateral authority to undermine a duly enacted law of Congress, one that's so important for working families that are trying to find good quality health care coverage for their kids and their families. If you don't have your health, you got nothing. How can you provide for your family? How can you provide for your children? How can you get an education? How can you get a job? How can you get job training? And by every deliberate step that the president takes to undermine the basis of the healthcare system is a step towards undermining everything that is necessary to have stable markets, good quality healthcare that's affordable and actually covers you when you're sick. So we're proud to lead a nationwide effort. We're willing to step out in front because what's at stake for the city budget and what is at stake for every family in every neighborhood in the city of Columbus. And you're going to hear from two individuals today that, but for good quality healthcare and insurance, they would be struggling. And so it's my honor now to turn over to the podium Dr. Mashika Roberts. She is the commissioner of the Department of Public Health, to hear the real consequences that she deals with every day in providing good quality health coverage to all the city residents. So, Dr. Roberts, thank you.
Well, good afternoon, and thank you so much, City Attorney Klein. It's really an honor to join all of you on behalf of the health of all of Columbus residents, and really all residents across our country. At Columbus Public Health, we work hard every day to protect health and improve lives. The Affordable Care Act has been and continues to be a tremendous tool in our efforts to improve the health of our residents and all of Americans. Access to health care is a right. It is not a privilege. And because of the Affordable Care Act, many more people now have access to affordable, quality health care as well as prevention, which is key to reaching optimal health and saving dollars as well as saving lives. The Affordable Care Act is the first step in turning our healthcare system from an ill care system to a healthcare system. For far too long, sick visits were paid while prevention services were utilized by a lucky few who were fortunate enough to have insurance that covered them or the means to pay for it on their own. All that changed with the Affordable Care Act and the essential health benefits it guarantees for all Americans. The Affordable Care Act has allowed us to serve more people and to make our limited health care dollars go further. Thanks to Medicaid expansion, we now bill for services at the Columbus Public Health Department that once had to be offered for free. Other city agencies similar to ours have seen similar results with the Affordable Care Act and Medicaid expansion. For example, the city bills for EMS runs and now reimbursement, as City Attorney Klein mentioned. Our reimbursement rates are up as a result of the Affordable Care Act. This saves the city money and allows it to redirect those dollars to other crucial city services. We also provide funds to Primary One, which is the largest federally qualified health system here in our jurisdiction. We saw the number of uninsured patients and the amount of money they recoup. The number of uninsured go down and the amount of money they recoup go up as a result of the Affordable Care Act, allowing them to use their resources to provide other critical services. And while we face an unprecedented opiate crisis, Medicaid expansion has allowed more people to enter into treatment that they desperately need to treat this brain disease of addiction. Overall, nearly 20 million people across our country have benefited from the Affordable Care Act. These are people just like you and me, people who want what we want, the right to good health. At Columbus Public Health, I see firsthand prevention services such as perinatal care, family planning, women's health, STI testing, treatment, and counseling, as well as drug and alcohol prevention and treatment services help people live healthier lives now, today, while preventing and delaying costly illnesses in the future. You know, with all the rhetoric, it sometimes is easy for us to forget that the Affordable Care Act is not about ideology, nor is it about politics. What we're talking about are real people and real people's health. A mother who gets a mammogram for the earliest identification of breast cancer, a brother who has his annual well visit to prevent and address a chronic disease for the healthiest and lowest cost intervention, and a child who gets vaccinated to prevent a deadly disease, and a best friend who is ready and able to enter counseling and treatment for drug addiction. All of them, as well as all of us, now have access to these cost-saving and life-saving prevention services, regardless of insurance and regardless of ability to pay. We need to continue the progress that we've already made toward health for all people, not stop right in our tracks. This is a health issue. This is not a partisan issue. The residents of Columbus, as well as communities across our country, deserve better. It is time to stop playing politics with people's access to health services, their health, and their lives. Any attempt to dismantle the Affordable Care Act will have devastating consequences on people. People like Denise Jacobs and Josh Lapp, who have pre-existing health conditions. Please help me welcome Denise and Josh to the podium. Thank you.
Hi, I'm Denise Jacobs, obviously. So in 2011, I was diagnosed with interstitial lung disease. I was monitored for every 3 to 6 months by my pulmonologist. And it kept sort of stable until 2014. And then I started getting more short of breath and had trouble doing my job without help from my co-teachers. I was a preschool teacher. So at that point, my pulmonologist retired, so I had to find a new pulmonologist. And so I found him, and when he saw me, he said, "You need to have a lung biopsy immediately," which it was an open lung biopsy, which is surgery. So that was pretty terrifying, but I had to go through that. And then I tried to go back to my job, but in February 2016, I realized I just couldn't continue. So I had to quit my job. And then, so I went along being monitored, going through pulmonary therapy, and I've never smoked So they were trying to figure out what caused this. Well, the lung biopsy showed that it was caused by an autoimmune disease. So we tried to treat the autoimmune disease, and that didn't, work. So I continued to go downhill and went on oxygen. I started with low amounts of oxygen on exertion, and within several months, I had my oxygen level increased until I had to be on it 24 hours. So then in December of 2016, when I went to see the doctor, they recommended me for a lung transplant. So I said, well, let me think about it. And they said, well, start testing. So I started all the testing that was required to do that. So by February 2016, I was on so much oxygen that I needed two heavy-duty concentrators in tandem. And it was hard to leave the house because I would run out of the tanks that I needed to use. So I was actually approved for lung transplant in May. And June 4th, on 2017, I had a bilateral lung transplant. So now I am living on, I have to have anti-rejection drugs. I have to have those in order to survive. And I have a real concern that if President Trump doesn't support Americans with pre-existing conditions, that some people like me may have trouble affording their life-supporting drugs. So that's what I have to say.
Hello, my name is Josh Lapp. I am a small business owner, and I also was born with a congenital heart defect known as transposition of the great arteries. It's a mouthful. Essentially, my left and right ventricle of my heart is switched, so I actually had to get open heart surgery at birth. I have, a longer medical history than a resume, so you can imagine how many operations that I have had. And today, I'm kept healthy by my doctors at Ohio State and by an ICD pacemaker implant that regulates my heart rate and ensures that nothing bad happens. So I'm also a small business owner, and I just so happened to start my small business the same year that the Affordable Care Act marketplaces came online. And I remember, when I was 17 or so, my dad saying, well, the first thing that you're gonna have to do is get a job out of high school so that you can get health insurance. Okay, so I didn't know anything about health insurance at that time. When I got on I was out on my own, I was out of college, nearing the age where I really had to start taking care of those things on my own, I came to understand, yes, I must have a job that provides me health insurance, or I will not be able to get health care, or I will, be bankrupt because I won't be able to afford my procedures, which cost some upwards of $100,000 every, 5 to 10 years. So, in 2014, I got together with my now business partner, and said, we want to start a business. We're urban planners. We want to be innovative. We want to create jobs. We want to help our communities and also, grow our business. Well, I couldn't quit my job and lose my health insurance. So, thankfully, the Affordable Care Act came into place around that time. We both quit our day jobs. We started our own business. We now have a third business partner and an employee, and are doing projects all around the state of Ohio and around the country. And we are only able to do that because we can both get health insurance on the healthcare exchanges. So both of our husbands also are small business owners and also get their health insurance. We're both thinking of starting families. And what does that mean? We have to have health insurance through the exchanges. There's no other way for us to function as business owners. So to me, this is not just something that impacts my health and well-being and livelihood and life, but it's also an economic issue. You know, we create jobs. We're small business owners. Without this health insurance through the marketplace, there's nothing that we can do. We will have to quit our jobs, we'll have to close up our business and go back to working for someone else. And so to me, whether President Trump and his administration and their allies in Congress repeal the Affordable Care Act or they kill it by 1,000 cuts, it doesn't really matter. What we need is strong health insurance, affordable health insurance, and that's only done now through the marketplaces, and all the actions recently have only served to impact negatively the health insurance marketplaces. So I already know that my premiums are likely to go up next year. That's okay, at least I still have health insurance. But the actions that City Attorney Klein and others are taking today are really important and impactful in my life, both for my health and my financial livelihood. So I thank him and the others that are taking these actions today. Thanks.
So, as you can see, there's a lot at stake. There's a lot at stake. Yes, the city's budget is threatened because the number of uninsured increases means less money we can recoup on fire runs. Yes, the city's budget is threatened because it means there's less uninsured when the Department of Public Health provides them with the necessary coverage, or Primary One provides them with health insurance. But for every intentional tweet, every intentional statement, every intentional action to undermine the Affordable Care Act, it has real life consequences to the Joshes and the Denises of the world, to families that want to have affordable, good quality health care coverage for raising their family. And by the way, Brookings just came out today and said that if you just would have left Obamacare alone, premiums, Josh, would not be increasing. There is intentionality that's undermining the market and hurting everyday people's lives. And sometimes I think the president in Washington forgets that, and he's violating the law of the United States in doing so. And we're here today to hold him accountable.